Now to a health alert this morning. There is a condition that many women may not realize they even have that could make it more difficult to detect breast cancer. I mean, so much so that cancer could be missed by a normal mammogram. About 40% of women have dense breast tissue, which makes it difficult to distinguish between cancer and tissue during a woman's yearly scan. Now, it happened to Nancy Capello, who is here to share her story along with the medical director of breast imaging for Baptist Health, Dr. Trishna Patel. Good morning, both of you. Thank you for being here. And thank you for coming on and sharing your story. It is so important. Now, 2 mammograms then missed cancer. Can you walk us through what happened?
I sure can. I mean, Jen, I never thought I'd be traveling all over this world talking about this story, but it's common. As you said, 40% of women have dense tissue. I was a healthy patient. I never missed an appointment, had my yearly mammograms, exercised daily, and I had 11 yearly mammograms, and I ended up with late-stage disease, missed on mammogram because of dense breast tissue.
How, Dr. Patel, how does that happen?
Well, essentially, you know, dense breast means that your breasts show up white on a mammogram, and unfortunately, if a cancer were to develop, it would be white as well. And so we're dealing with having to pick up something that's white, superimpose on something that's already white. And so we've known for years that it's very difficult, and it limits us, and it limits the mammogram in detecting the cancer in someone who does have dense breasts, as Nancy has.
So how do you know if you have that? Is it based on
the pictures,
size, or the pictures?
The picture. So it's nothing that you can feel. It's nothing your doctor can feel. It's nothing based on exam. It's something that is seen in the pictures and the X-rays and the mammograms.
So is that why it's important then to have a conversation, not necessarily with the doctor who maybe ordered the mammogram for you, like my OB will order it for me every year, but with the radiologist or whomever is reading it?
Absolutely, both, absolutely, both. So, you know, the radiologist, we are trained to not only recognize the dense breast, but we also have the knowledge and the expertise of other modalities that are available. We call it adjunct screening, additional technologies, MRI, molecular breast imaging, ultrasound, that we have as tools to help those women still receive the same access to early detection, essentially.
Now, it's interesting, Nancy, because as a result of what happened to you, then you wanted to get involved, obviously, and you specifically started an organization. In fact, Are You Dense Incorporated?
Yes.
What are you hearing from other women? Are they sharing similar stories to yours?
Oh, my word. So, Jen, when I was diagnosed with this advanced stage disease and found out I had dense tissue, I ended up going to the legislature. I'm from Connecticut, and we actually were the first state in the nation to disclose dense breast tissue to the patient through the mammography report, because doctors may know it, but the patient doesn't. So of course I wanted to initiate the conversation, but I never knew I needed to. And so I started hearing from women all across the nation, because we have a website, areyoudense.org, saying, oh my God, that's my story. In fact, we're working in Florida with a woman by the name of Tammy, had a similar story as mine, trying to pass legislation in Florida. Right now we have 32 states across the nation, and we have to get Florida on board so every woman, no matter where she lives, knows her density and can talk to her docs about her breast health. Very important.
Now, are these women telling you that perhaps there was a breakdown in communication between the radiologist who read their initial mammogram that came back as normal and that they weren't notified necessarily? Because sometimes you don't always read. As soon as you read normal, you're like, okay, let's file that away for next year.
You read the first sentence and you say, good, let's go on to the colonoscopy. That's what I said, because I had the same results. It was normal. What women are saying to me that they never knew they had dense breast tissue. And if you don't know how to even talk about this. I never knew. I never thought I'd ever have breast cancer. I'm an average risk woman, and actually the truth of the matter is that 75% to 80% of women who get breast cancer are average risk. So ladies, be smart about your breast health, and if you live in the state of Florida, please ask your docs, what is my breast tissue composition? What is my breast density? And talk to them about adjunct screening.
Yeah, it's interesting. Are there symptoms? Is this genetic?
No, there's probably a hereditary component, but nothing that has been recognized. But there are no other symptoms. There's no other way to know. You know, it's something that we just see on the pictures.
And the patient themselves, she could be experiencing no kind of symptoms or illness at all.
Absolutely.
Exactly.
How are you now? You
I'm
look
great.
wonderful.
Well, thank you. I'm great. But, you know, the truth of the matter is the type of cancer I have can recur, you know, up to 20 years. I'm 13 years out. Every day is a blessing. I do want to say that we're really fortunate here in Jacksonville that Baptist Health, even without legislation, they disclose density to the patient voluntarily. That's the right thing to do.
Thank you both. Thank you for sharing your story.
Thank you, Jen, for
Dr.
having
Patel.
us.
I mean, this affects so many people. Absolutely. It's important to spread the word.
Thank you.
Now, to learn more about dense breast tissue, we have posted a link to rudense.org to this story, as well as a link to the Hill Breast Center at Baptist, where Dr. Patel works, on our website, news4jax.com. You can also watch and share this interview, maybe with a friend who you think might benefit for knowing about this condition, by going to the Morning Show page when we post it later this morning.